Hi, my name is Morgan Schutte, and I've decided to give a PSA on methicillin-resistant Staphylococcus aureus, more commonly known as MRSA. As indicated by the name, it is known for being an antibiotic-resistant bacterial infection, more specifically a staph infection. MRSA is caused by the bacterial agent Staphylococcus aureus. The bacteria primarily targets the skin as it appears as a lesion. It is transmitted through skin-to-skin contact with an infected person, as well as skin contact with infected surfaces and materials. Skin that is already damaged or broken can actually have the bacteria enter this way as well. And as I previously mentioned, it is highly resistant to antibiotics, which makes the infection worse than a regular staph infection. 3% of people actually already have the MRSA bacteria in their nose. Typically, these are not going to be the people that end up getting sick from the bacteria. However, because they are carriers for it, it can spread to people that have an increased risk for getting the infection. Anyone can get MRSA, but there are 4 groups of people that are most at risk for developing an infection. The first is athletes. They share equipment and supplies, which increases the risk of MRSA existing on these objects and being passed from one athlete to the next. Additionally, sports typically include close skin-to-skin contact, which transmits the bacteria from one athlete to the next. Military personnel are also affected, as those in barracks are also sharing equipment and close spaces. Children in daycare or school are also susceptible to MRSA because they share toys and personal space. And as we know, children typically will put toys in their mouths or get up in other kids' faces, so it can spread the bacteria this way as well. And finally, patients in surgery are at risk for this bacteria too. Medical devices could already be infected with the bacteria, so it spreads to patients through use. Whether it's a device that is being used to perform the surgery or something like a stethoscope that is just being used to check on them, it could have the bacteria on it already. Healthcare providers can also spread the bacteria if it's on their hands from working with one infected patient and end up spreading it to another one. So MRSA appears as a bump or infected area on the skin. Upon first look, it might appear to be a spider bite in an area that is covered in hair. Generally, though, if a spider isn't seen, it can be assumed that it's an infection. The infected area will be red, swollen, and full of pus, which is an indication of the infection. It is typically pretty painful, warm to the touch, and accompanied by a fever. It is not a very pleasant looking infection, so I chose the best picture that I could. MRSA prevention is very important since it is antibiotic resistant. This can be done through maintaining good hygiene, such as washing hands and showering, especially after exercise in the case of athletes. Personal items such as razors, personal hygiene products, and towels should not be shared as they could be infected with the MRSA bacteria. Things such as needles could also have the bacteria and be spread through injection sites. Cuts and wounds to the skin should also be cleaned and covered until healed, as exposed infections could spread to surfaces and infect other people, as well as open cuts could let the bacteria enter the body. And finally, if an infection like this does occur, you should go to the doctor. Waiting could not only make the disease worse, but also increase the chances of spreading it to other people. If MRSA is left untreated, it could turn into pneumonia or other infections in the body, such as those at the surgical site in the case of surgery patients, as well as sepsis. It can also result in death if sepsis does occur, so it's important to take these prevention steps in order to avoid MRSA from occurring and escalating. If the prevention steps happen to begin with, then MRSA cannot escalate into things like pneumonia and sepsis, which is why it's important to just prevent it to begin with. There are 3 antibiotics that can be used to treat serious MRSA infections. However, they aren't always effective. If the antibiotic isn't helpful, though, the dose must be finished anyways in order to prevent antibiotic resistance. Because of the resistance, antibiotics aren't always suitable and effective for everyone. So treatment typically will just include draining of the abscess and cleaning or covering the wound. And here are my sources. Thank you for listening.